Fung here. You're about to see a scan from St. Joe's that's brought to us courtesy of Dr. Eddy, but I wanted to set up the case first. Mary saw a patient that was struck in the right shoulder by an airbag and had these x-rays. The AP and the Y-view films show a posteriorly dislocated shoulder. It's pretty obvious here on the axillary view as well. X-rays are great, but since we've arrived in the future, I thought I would share the ultrasound of this patient's shoulder with everyone as well. To evaluate a shoulder dislocation, you're going to want to use the linear probe and place it in a transverse orientation on the posterior lateral aspect of the shoulder just below the level of the acromion, and then fan down to visualize the humerus as it sits in the glenoid fossa. Here, we are looking at the patient's normal shoulder, and you can see the glenoid here, the humeral head here, and the infraspinatus tendon as it externally rotates the humerus. Now, let's take a look at the patient's affected shoulder. In this still image, you can see immediately that something isn't right. The humeral head is way up here, and the edge of the glenoid is much deeper here. And remember, we are imaging posteriorly, so this is a posterior shoulder dislocation. So now in this clip, as we fan up and down from the humeral head, we see some hypoechoic and anechoic areas just superficial to the glenoid, which is likely blood. If you didn't have the x-rays or the obvious shoulder deformity to work with, you'd now be pretty certain, based on just your ultrasound, that this patient was dislocated posteriorly, and you would then apply the requisite yanking and pulling. After doing so, you would probably see this. The humeral head is now seated within the glenoid fossa, and you can see that it rotates in this clip as you externally rotate the adducted upper extremity. Success. For the more common anterior dislocation, you would see the humeral head displaced anteriorly relative to the edge of the glenoid. Also, ultrasound can be very useful in larger patients or post-reduction if you're not sure that you got it in. Overall, this is a very cool scan and not a type of dislocation that you see every day.